Is basically on the anterior cranial fossa. Anterior cranial fossa is the front part of the floor of the skull cavity. The main job of the anterior cranial fossa is to hold the frontal lobes of the brain. So you can think of it as the front of the skull, which holds the frontal lobes of the brain. And it's the shallowest cranial fossa. So the depth of the anterior cranial fossa is the most shallow. It's the least depth when compared to the middle cranial fossa and the posterior cranial fossa. Now let's see the bones that form the anterior cranial fossa. Now here in this image, you can appreciate that the blue shaded bone is the frontal bone. The light purple shaded bone is the ethmoidal bone or the ethmoid bone. And this yellow colored bone all the way in the middle with these two wings is called the sphenoid bone. Just appreciating that we have the frontal bone here, the ethmoidal bone here, and the sphenoid bone here is enough. Okay, so in the front we have the frontal bone, in the middle we have the ethmoid bone, and in the furthest back we have the sphenoid bone. Now the anterior cranial fossa basically ends at the lesser wing of the sphenoid. For that, you must understand or appreciate the sphenoid bone. Now, if I take this yellow part of the bone here and I imagine it in different colors here, I'm basically working with my sphenoid bone. I'm working with the yellow bone here, just the yellow bone, not the orange bone, not this rust bone, not the blue or purple one, the yellow one. That's our sphenoid bone. When I talk about the sphenoid bone, I have this green lesser wing for the sphenoid bone. I have this rust colored greater wing. And then I have the pterygoid processes in yellow and then the body in blue. So you can appreciate that this green colored lesser wing of the sphenoid bone makes the posterior end or the posterior boundary of the anterior cranial fossa. Now, important structures in the middle, basically, let's start from the front to the back. So if I take the most front part, I shall start with this image. Now, look at this frontal crest. The frontal crest is basically a small bony prominence or ridge in the frontal bone. And this is the attachment of the falx cerebri. Now, the falx cerebri is basically dura mater. Let me show you the falx cerebri. Can you appreciate this image? So, this is the falx cerebri. All right. The falx cerebri is a large sickle-shaped vertical fold of dura mater that separates the two cerebral hemispheres. It's situated in the longitudinal fissure and it provides structural support, houses venous sinuses, and acts as a boundary during brain injury. So basically, the falx cerebri is a fold of the dura mater that separates the two cerebral hemispheres of the brain. And it's attached to the crista galli anteriorly and the tentorium cerebelli. So let me show that to you. The first thing we saw was the frontal crest. Now the frontal crest also attaches the falx cerebri and the crista galli here also attaches the falx cerebri and then posteriorly the tentorium cerebelli attaches the falx cerebri. Here posteriorly you can see the tentorium cerebelli here. This is the falx cerebri, right? So the falx cerebri extends all the way from the frontal crest. Here it extends on the frontal crest on the crystal galli, and then posteriorly it attaches with this tentorium cerebelli. Okay, it's basically composed of two layers of meningeal dura mater that form a crescent-shaped partition between the left and right hemispheres of the brain. So it descends in this midline from the crista galli and frontal crest anteriorly to the internal occipital protuberance posteriorly, right? Basically, it houses the key dural venous sinuses, including the superior sagittal sinus and the inferior sagittal sinus, which are essential for blood and CSF transport. Now, moving on. Now we know that the falx cerebri anteriorly attaches to the frontal crest, the crista galli, and blends with the posteriorly with the tentorium cerebelli. Okay. Now, moving on, we've talked about the frontal crest. Okay, now we move on to something called the foramen cecum. Can you see this foramen cecum here? This is a small hole between the frontal crest and the crista galli behind or posteriorly. So this foramen cecum is basically usually closed, but if it's open, it basically transmits something. What does it transmit? We have the nasal cavity beneath this, and the foramen cecum is a small hole, right? And above this foramen cecum, you have the superior sagittal sinus. So what will happen? If the hole is open, any infection beneath this hole in the nasal cavity is going to transmit from this foramen cecum into the superior sagittal sinus, and infection can basically spread. Now, what's this crista gali? This crista gali is a vertical projection of the ethmoid bone. It looks like a rooster comb, and the function is basically the attachment of fox cerebri. We've talked about this before. Then we have something called the cribriform plate. This cribriform plate is basically a sieve-like plate. Sieve means lots of small holes, like a chutney, like a strainer. So we have this sieve-like plate, which is called the cribriform plate on both sides of the crista gali. And what's important is that through the cribriform plate, olfactory nerve fibers pass. Okay, so what is the point of olfactory nerve fibers passing from here? The olfactory bulb or the olfactory sense is basically how we smell, right? So look at it here. All this cribriform plate allows these olfactory nerve fibers to pass through it and carry the sense of smell from this nose underneath to the brain up, right? So these olfactory nerve fibers, cranial nerve 1, pass from the nose up to the brain. Moving on to the ethmoidal foramina. These are small openings for nerves and vessels. Now we have two ethmoidal foramens, right? So in this ethmoid foramen for plate, we have two foramens, the anterior and posterior ethmoidal foramina. So foramen means hole. We have an anterior one and a posterior one. The anterior one transmits the anterior ethmoidal nerve, artery, and vein, and the posterior one transmits the posterior ethmoidal nerve, artery, and vein. These supply the nasal cavity and sinuses. Right, let me show them to you further here. So this is the orbit, right? We're looking at the orbit here. So this is your lacrimal bone. This is the inferior orbital fissure. This is the superior orbital fissure. And here you can see the anterior ethmoidal foramina and the posterior ethmoidal foramina, which are basically supplying the nasal cavity and sinuses. This is the below picture or the inferior view, and this is the superior view, right? You can even appreciate the anterior and posterior ethmoidal foramens here, right? You can see now we have something called the lateral part of the anterior cranial fossa. Let me show that to you here. The lateral part of the anterior cranial fossa is formed by these orbital plates of the frontal bones, right? So these orbital plates of the frontal bones form the lateral parts of the fossa, and these separate the brain above from the orbit below, right? So the orbit contains the eyes below it and the brain is above it. So you can see impressions of the brain on them, and they're called these brain gyri. These impressions are called the brain gyri, right? The clinical importance is if foramen cecum is open, we said. Let me look for the foramen cecum here. So if this foramen cecum is open, we said that the nasal infection can travel to the superior sagittal sinus and there's a risk of meningitis, right? Meningitis is inflammation of the brain. And the cribriform plate, for example, let me show you the cribriform plate in detail. Look at the cribriform plate. So this is the cribriform plate and this is the crista gali, right? This is the vertical bony projection of the ethmoid bone, and on both sides is the cribriform plate. If you get a head trauma and you get a cribriform plate fracture, there's CSF leakage from nose, right? Because you're going to lose the CSF from the brain through the nose here, and that is going to cause CSF rhinorrhea. So basically, you have in your nasal fluid, you have the cerebrospinal fluid because it's coming from here. And there can also be loss of smell. Basically, you have anosmia. Anosmia is loss of smell. Why? Because all these sieve-like holes were allowing the nerve fibers, olfactory nerve fibers, cranial nerve 1 to pass. And since it's fractured now, that's not going to be easy anymore, right? Um, so you can imagine that the anterior cranial fossa is basically like the smell center of the skull because the anterior cranial fossa has the cribriform plate through which the olfactory nerves pass for smell. Another thing you should know is that the foramen cecum sometimes houses a vein called the emissary vein. These are small valveless vessels that traverse the skull foramina to connect the extracranial veins. Basically, it's a scalp with extracranial dural venous sinuses. So they allow bidirectional blood flow and that helps to regulate intracranial pressure and aids in brain thermoregulation. So sometimes you have an emissary vein traveling from this foramen cecum. I would like to show you the anterior and posterior ethmoidal grooves here also. So this is the crista galli, this is the cribriform plate on both sides. That is your anterior and posterior ethmoidal grooves that we saw so inferiorly on the orbits also. And let's look at the sphenoid bone from a superior endocranial view, which is the central bone of the cranial base. But this part is basically the posterior boundary of the anterior cranial fossa. It's important because it forms the posterior boundary of the anterior cranial fossa and the central part of the middle cranial fossa. So let's look at it one by one. We have first here the lesser wing of sphenoid. This is the lesser wing of sphenoid. These are thin horizontal wings that project laterally. You can see that the wings are basically projecting laterally. And the role in anterior cranial fossa is they form the posterior boundary, right? And the medial end forms the anterior clinoid process. Let me show you the anterior clinoid process. Um, Here, look at this. So this is the anterior clinoid process. This structure gives attachment to the tentorium cerebelli. Okay, just like we had the falx cerebelli, we also have the tentorium cerebelli, and this structure gives attachment to the tentorium cerebelli. Again, the tentorium cerebelli is a major dural reflection. It's like a tent-shaped fold of dura mater that forms a roof over the posterior cranial fossa. So this anterior clinoid fossa attaches that. And now we move on to the juguum sphenoidale. Okay, I want to show that to you because it is important. Here, look at this juguum sphenoidale. This is basically a flat midline plate between these two lesser wings. It lies posterior to the cribriform plate of the ethmoid. So remember that the plate was just here and this is behind it, right? So it forms part of the posterior floor of the anterior cranial fossa. And then we have the um, prechiasmaticus. So this sulcus prechiasmaticus is a groove just posterior to the juguum sphenoidale. So can you see the sulcus here? What lies here? Basically, the optic chiasm is present here. And the structures nearby here, we have the optic nerve, optic canal, and internal carotid artery. All three are present here. Okay, then we have the tuberculum cellae. The tuberculum cellae here, can you see this here? The tuberculum cellae is a small ridge forming the anterior boundary of the sella turcica. So this is the sella turcica, and the anterior boundary is formed by the tuberculum cellae. And the point of it is just that it's the anterior boundary of the sella turcica, because the sella turcica itself, this sella turcica it literally means Turkish saddle. So in Turkish, the Turkish saddle is called sella turcica, and this depression basically contains the pituitary gland, the hypophysis, which is why it says fossa hypophysealis here, because this area contains this depression basically contains the pituitary gland. The hypophyseal fossa is the deepest part. This fossa hypophysealis is the deepest part of the sella turcica, where the pituitary gland sits, and you must remember that any pituitary tumors press upward on the optic chiasm. And the result is basically bitemporal hemianopia. All right, remember that any pituitary tumor here will press on the optic chiasm upward, and you will get a bitemporal hemianopia. Then we have a dorsum cellae. This dorsum cellae basically is the posterior wall of the sella turcica, right? And from here arise the posterior clinoid processes. Let me show you the posterior clinoid processes here. This is the posterior clinoid process here. So this is the posterior clinoid process. These basically attach to the tentorium cerebelli, right, which was a fold of the dura mater. Then we move on to the greater wing of sphenoid. When we talk about the greater wing of sphenoid, these are basically this rust area, this rust-colored greater wing of sphenoid. These are large lateral wings and they form three foramens. Okay, I'm going to show them to you here. Okay, I can't really see them here, but three foramens are present here: the foramen rotundum, the foramen ovale, and the foramen spinosum. Now look at this here, the foramen basically, can you appreciate this here? The foramen rotundum is the most anterior one. The foramen rotundum basically carries the cranial nerve V2, and then the foramen ovale carries the cranial nerve V3, and the foramen spinosum carries the middle meningeal artery. Okay, and then we have the anterior clinoid process. Can you see the anterior? This is the basically the anterior clinoid process, and this is the posterior clinoid process. So the anterior clinoid process is the projection from the medial end of the lesser wing, and again, its attachment is important for the tentorium cerebelli. Right? I guess that's enough for the sphenoid bone.